Hi, Michael.
Hi, Jaime. How are you doing?
Good, long time no see.
Yeah, how you been doing? Everything good in Mexico?
Yeah, well, yes, in Mexico City, yes. It's. I want to say everybody welcome to tonight's program. It's completely live. It's 8 o'clock in Mexico City, 9 p.m. in New York City. Mexico City is a clear night, kind of chilly, 17 degrees Celsius, but the air is chilly. New York City is 18. We're almost the same weather. But I want to use this opportunity to send a big hug to all our friends in the Yucatan Peninsula, especially in the Mayan Riviera, because they were just having rains from the Gamma small hurricane, but they're about to get hit with a Category 4. It's called Delta, and it's going to hit the Mayan Riviera, Tulum, Cancun, uh, all the peninsula around 2 o'clock in the morning. So, to all our friends over there, please stay safe. I know that many people have been evacuated. 35,000 tourists were evacuated from the seashore into mainland, and we hope for the best. The world is going Mother Nature is upset, Michael.
I think she's upset. I mean, if you look at California, they have this now over 4 million acres. The size of Connecticut is now burning in California. It's,
Yeah,
yeah, the nature is angry with us. No question about it.
yeah. Well, and it's very nice to have you back. It's been like 3 weeks, and uh, we've had a few nice programs in Spanish. Too bad your Spanish is still not that good. We're gonna get you some express classes, so you can join us also on the Mexican lectures. So. Well, I think we're going to go to a short video, and we have a great program tonight with a very special guest from the University at Buffalo. So don't go away, we'll be right back.
Observa el estado de la salud de la cavidad bucal mediante la detección de actividad bacteriana de una forma más clara, sin la necesidad de utilizar agentes externos. Visualiza placa dentobacteriana activa y no activa, microfracturas, filtración de restauraciones, caries, desmineralización, valoración de estado periodontal, valoración de prótesis dentales, zonas retentivas de placa dentobacteriana, auxiliar visual para el paciente. Funciona a través de la tecnología QLF, que incide la fluorescencia sobre uno de los elementos residuos de las bacterias. La porfirina que se revelará en el filtro de la pantalla, marcando un color más rojizo, dependiendo de la cantidad de porfirina presente, lo que diferenciará la placa nueva de la placa vieja, así como las zonas de gran actividad bacteriana. Encuentra esta poderosa herramienta para llevar a cabo todas tus mejores ideas dentales.
Great. Welcome, Violet. Um, you're also in New York State, right?
Yes.
Yes. Well, Michael, I think I'm going to let you introduce Violet to our audience tonight.
Thank you. So Violet is both a colleague and a very good friend. We have known each other for many years, over 10 years. And Violet has a very solid background when it comes to dentistry. Not only is she a basic researcher, she's also a clinical researcher. She has a PhD. She's boarded in periodontology. She's also boarded in prosthodontics. And she's putting all that together in her in her role right now as the chair of restorative dentistry at the University of Buffalo. And Violet has been at University of Buffalo, I think, for maybe 20 years plus, something like that. She is the chair of the department, and she is also has an honorary doctorate from university in Szeged. I don't know, I hope I pronounce it correctly, in Hungary. She has published numerous publications, and she has hundreds and thousands of dollars worth of research grants. So it's with great pleasure that we have Violet, Dr. Professor Harasti, with us tonight, and she's going to talk to us about halitosis.
Thank you, Michael, for this very generous and very nice introduction. I really appreciate it. And I am honored to be invited to this to do this presentation for your prestigious panel. And I wish everybody a good night, and hopefully everybody will fare well on Cancun and on the areas that are going to be affected today. That is very sad, but be hopeful that everything is going to go well for them. I assume that I'm ready to start my presentation. Yes?
Yes, please.
Okay. So tonight I will talk about halitosis, oral halitosis. When I originally started my research with halitosis, my interest was mainly in identifying organisms that are associated with halitosis in order to find a cure or better treat this condition. But during the years, I realized that halitosis is more than just an oral condition and just a cosmetic condition that can be annoying. May I have the next slide, please? May I have the next slide? So it is a condition that is has a lot of attention in the last couple of years or last many years right now. Many clinics are opening in order to help the patients who are affected by these very debilitating conditions in some situations. I did not realize that until I got involved with the patient population who is affected by this condition. They are quite desperate and seeking care and advice how to get rid of this condition, because it's quite a hard condition to treat and socially affects people. They are support groups that approached me in order to find cure or give advice to them. And until I got involved in this research, I had no idea what a debilitating condition it could possibly be for some people. May I have the next slide? This condition is just as an interesting fact that is not just for humans. The dogs are quite affected by this condition, and products that I sold for dogs to cure or alleviate their halitosis or bad breath is quite a big industry, is making a lot of money. Next slide, please. There are meetings right now that we started it several years ago. Like this one is from 2007 that it's indicated, but it's called International Society of Bread Bath. That is where we present papers and research and treatment options and new findings treating this this condition. May I have my next slide? So what is really halitosis, and what am I going to talk about today? It is the chronic halitosis that I'm going to address, not the one that the morning breath or when we eat food that cause bad breath, like garlic or smoking or alcohol that make us dry, but it is the chronic halitosis that persists through the times. So halitosis is one of the major embarrassing health problem, could be, but my goal today is to draw attention that halitosis is a significant problem, not just as a social problem and causes of social isolation and embarrassment. Some of these people are quite affected, and they don't go to public and don't go to churches because they think that they are people are not don't want to talk to them and don't want to be associated with them, and it can be a major problem for them. But also halitosis could be a problem, like a local problem in the oral condition, affecting the tissues and the oral cavity, and also could be a far-reaching problem as well in the connection of oral diseases and systemic diseases. But it could be a sign of a major problem or a major disease in the body. So my take-home message would be that halitosis could not be just dismissed as a bad breath and a cosmetic problem, because it could have a much more and significant could be a much more significant condition that cannot be just dismissed. So there are also conditions that called halitophobia, that about 25% of the people who think they have halitosis, they don't have it. But this condition is very, very hard to treat, and I met a number of patients who have this condition, and it is mainly associated with obsessive compulsive disorders, and even suicides were reported with this disease. They cannot be really treated because they don't have the disease, but they think this fear of halitosis is really controlling their life totally. About 50 to 80 million Americans are affected by this condition, as we estimated it. There are no gender differences. Men and women are equally affected, and we spend millions of dollars, billions of dollars in order to alleviate, treat, or eliminate halitosis. So it is a $1 million industry that caters to this disease and lives on over-the-counter products that are addressing this condition. So how many people worldwide are affected by this condition is not really known, because we don't have a good data. Some countries did surveys, but it is really no good data on it, mainly because there is no good definition for the disease, and there's no very good way to measure the presence of this disease. There are some ways to measure it. And why do we want to measure a halitosis? It is to diagnose halitosis and also to monitor the changes of the treatment. So that will give us some idea that our treatment is effective or not so effective. The two major measurements are the organoleptic, like smelling the disease, and measuring volatile sulfur compounds. The organoleptic, or just smelling, the condition is it's quite uncomfortable, but in the research world, we usually use flossing and floss through the teeth interproximally, and smell the floss, which is really not that pleasant, but we calibrate each other so that we can follow the effect of the treatment. Also, the more a precise way is to measure the volatile sulfur compounds. May I have the next slide? With the halometer.
Lo que sigue.
May I have? So the halometer will measure the volatile sulfur compounds, which are very strongly associated or correlated with the presence of bad breath. So these machines we can use in research and also in dental offices. Also, there is another one, the oral chroma, that we can use as a measurement, and that measures three different volatile sulfur compounds, the three major ones. And but this is not as widely used anymore as the halometer. Next slide, please. There are some home devices also that can be used and widely sold, but they are not very precise, but they can give you some estimation of if especially if you go for a date, if if you're ready to kiss someone or not, maybe. But it's not for treatment devices to follow the treatment of the condition. Next slide. So what are the sources of halitosis? As you can see on this pie, about 15% of the halitosis is extraoral or systemic origin, but 85% of the halitosis or bad breath is oral origin. So mostly it is an oral condition caused by oral origin. So the next slide will show what are the extraoral causes of halitosis. They can be associated with lung disease or stomach conditions or also pharyngitis, sinus problems, postnasal drips or tonsillitis, and a number of other conditions. These are just a few to mention that are systemic conditions associated or could lead to halitosis. The breath are as air reflects the arterial blood, so it's condition in the blood, in the lungs, stomach, and the mouth. So these are the exhaled breath from our body are associated with the air that we reflect. Next slide, please. But in rare cases, the breath can be a sign of a significant general health problem. So that is when that it cannot be ignored. It could be associated with, as the next slides will indicate. Next slide, please. With a number of conditions, serious conditions. And the research, especially in the last couple of years, shows that certain scent or smell is associated with certain form of a systemic disease. We all possibly know that, for example, diabetes is especially the uncontrolled, not controlled or not controlled, well-controlled diabetes can lead to the acetone-like smell, and we all know that as dentists. But some other diseases are very common, like the liver disease is associated with a special smell. Pneumonia can be leukemia, and a number of diseases, even breast cancer, is associated with a certain disease. And interestingly, that it's fascinating to me that dogs and cats can smell certain cancers before it's actually detected by other ways. And researchers are studying the smell and the compounds that what are those smells that the dogs and cats can smell that identify cancer. So that is an interesting study in the last couple of years to find. But I just want to emphasize that certain conditions, serious conditions can be a sign or manifest themselves as bad breath. So bad breath has to be taken seriously. Next slide, please. Also, in the last couple of years, researchers found that it could be a genetic mutation that is associated with bad breath. Unfortunately, these people who have the genetic mutation are impossible to treat, so they have to live with this condition, and they can make some lifestyle changes and some changes in their diets, but it's impossible to treat them. This is a genetic mutation in CELN BP1 gene that I don't have time to get into this interesting research area, but it is very fascinating that bad breath is actually associated with a certain genetic disorder or genetic mutation. We use a lot of medications, and many of the medications, 7 of the 10 medications prescribed today, is associated with dry mouth, which leads to bad breath. And these are a lot of these medications are that we use today, like a high blood pressure medication, um, decognitions, typically the antidepressants, are very commonly lead to bad breath. Next one, please. Next slide. Tonsilloliths, these are little stones in the tonsils, are quite common and they can lead to very potent bad breath when they are growing and they fall out. As dentists, we all see these little stones, and when they fall out or we take them out, the bad breath disappears, but they start growing again. So the patients who are prone to grow these stones are frequently have or battle very, very strong bad breath. It's been associated. Next slide will indicate that the hydrogen sulfide level is much higher, measured by the halimeter in patients with tonsilloliths or with presence of these stones. And without the tonsilloliths, this compound is not measured with the halimeter, so it's strongly associated with bad breath. The oral halitosis is mainly associated with poor oral hygiene, as we all can guess and know that. Dentures, especially the old dentures that are not cleaned well, soft tissue lesions, especially oral cancers, can lead to very bad halitosis. Gingivitis, periodontitis is also causing severe, sometimes very debilitating bad breath. Tongue coating and xerostomia is also associated with bad breath. How oral halitosis is caused is oral bacteria that are present in the oral cavity will degrade sulfur-containing amino acids, which are like the proteins and the food that we eat, and this degradation will create or produce volatile sulfur compounds, which are the major three ones are the hydrogen sulfide, methyl mercaptan, and dimethyl sulfate. I just have an interesting little story on that. When one of the patients that I treated, it says that it's highly toxic. And then the worst patients that I ever had that was on the halimeter, it was over 1,000. We didn't even know that it measures over 1,000 because usually 250 or over 200 is very associated with, but it's a very bad smell coming from a patient. But it can be really, really bad. So this bacteria break down proteins and food to volatile sulfur compounds, and depending on the bacteria and the food, different compounds are created, and these compounds are smelled differently. Like for example, methyl mercaptan is smell like feces or mud ball or other different smells are associated with these byproducts that bacteria break down, which are very unpleasant. So halitosis that I keep on pressing, it is important because these byproducts or waste products are also known as toxins. And the direct exposure to either of these metabolites or toxins can have a direct effect on the oral cavity, on the protein, and on the human gingival fibroblasts. So it can degrade periodontal tissues, so it can cause localized or destruction in the oral cavity. but also these volatile sulfur compounds, mainly the methyl mercaptan, are capable of inducing deleterious effect, so breaking down collagen or preventing collagen formation, also interfering with human immune response, causing damage to the periodontal tissues. So they are very important, not just smelling badly, but also causing bad tissue destruction in the oral cavity. Also, with the other part of my research was that we know that some of the conditions in the oral cavity can have far-reaching effect, like contributing to systemic diseases such as heart disease or preterm low birth weight infants, but increased levels of the toxin could possibly have or believed to play a role and created a link between microorganisms in the oral cavity and systemic diseases. In the oral cavity, the major area or accumulation of bacteria that are associated with halitosis are the surface or the oral or the tongue, especially the fissures of the tongue where the bacteria can accumulate and produce and degrade proteins to volatile sulfur compounds. In research, we correlate the accumulation of plaque on the tongue um, with the presence of halitosis, so a heavy coating, moderate coating, or slight coating. Heavy coating, usually patients with heavy coating on their tongue will have a much worse or much more severe halitosis or bad breath than people with clean tongues. So I'm not going to go through the detailed research, but we try to identify bacteria what are present, mainly present in patients with halitosis and not present in patients with no halitosis. One of our articles was published in JADA, where we published the identification of oral bacteria species associated with halitosis. We identified a number of organisms that were always present in patients with bad breath, and not so often or rarely with patients with fresh breath. So these are some of the bacteria that I'm not going to read to you, but so we went through and worked further with some of the organisms. For example, Solobacterium murray, which is the next slide shows that we studied these organisms and try to identify what is their contribution to bad breath. May I have the next slide? So this is one of the other articles that we published on bad breath and association of bacteria with bad breath. Next one, please. Okay, I'll stop here, and then if we have some discussion or questions on this part of the presentations, like
Michael?
Thank you, Violet. That was very informative. Now, Violet is also a clinician. She treats patients. She does a lot of implant surgery and so on and so forth. Have you seen any increase in halitosis with specific either fixed or removal prosthetics or implants? Is there any association with any of those type of things that we put in the mouth?
with implants, I didn't. I mean, mainly the denture. I guess denture, partial dentures, and denture tend to increase the presence of bad breath. It's just because they are much more difficult to clean. With the presence of crowns, if the crowns are not treated well or not cleaned properly, then I'll see bacteria and inflammation and bleeding around the crown. So they could they could increase, especially like defective restoration. Those are the worst that accumulate bacteria around the margins. So, and if you flush those, I mean, we all know that the smell of those areas is really bad. So defective restorations are the main culprits.
Yeah, I have one more question, a very quick question, Jaime, and that is, so I understand that there are specific bacteria that may be associated, but there are also a lot of this bacteria and food that gets stuck under these defective restorations. Now, you mentioned association between bad breath, heart disease, and adverse pregnancy outcome. Is that associated with both types? Because with defective restoration, I understand we get inflammation, and that inflammation obviously has been associated with these systemic conditions. But halitosis without inflammation, do you still see that association between halitosis and systemic condition?
We think there is because mainly the bacteria that we found associated with bad breath are gram-negative bacteria. That means that the anaerobic bacteria, because they hide in the deep in the tongue crevices, and so these are the same type of a bacteria that lead to periodontal disease and cause other inflammation. So and then it's mainly it's the and then also even if not that one, the bacteria that produce the volatile sulfur compounds, the toxins itself themselves are damaging to the tissues.
Thank you.
Violet, I don't know if I missed it, but I didn't see smoking or drinking. Is it only that they dry the
I
mouth so they fall in xerostomia, or?
I left it out because the drinking alcohol will lead to dried mouth. Cigarette smoking will lead to a bad breath, and the alcohol through the dry mouth. But since I'm more focusing on chronic halitosis, not the one that is caused by garlic and cheese products and alcohol. So since I had to cut it, I mean I'm cutting it back to a shorter. It's a big topic. It's a huge topic. So that's more like a transient version of halitosis, and that causes bad breath, alcohol and smoking, and stress. Stress
And
is another big factor.
so another thing to blame on COVID.
Yeah, exactly. Stress and
Now,
alcohol, because alcohol production went up, stress went up. So these are all big causes for halitosis.
Don't only
and
blame, don't only blame COVID. There's tequila involved here too.
Tequila
well,
is good.
you know, I
That's
used to treat many people from the Hungarian embassy, and one night I was invited by the first secretary to his house, and he gave me to try this alcohol that it's a pear liquor, very very strong, that you have to put a cube of sugar because it really burns your mouth if you drink it directly.
Palinka.
No, you don't. Maybe, I don't know. But after two of those, and then I took him for dinner and two tequilas, I was speaking fluent Hungarian. Fluent. And I used to know many fogorvos. No, fogorvos.
Yeah, fogorvos. Yeah, fogorvos. Yeah.
Fogorvos. He's dentist, right? And I'm
Yeah.
drinking water. So now listen, I was also very surprised to hear that very few. I thought that stomach issues, or maybe there are so many people with reflux now, would have a more would be more to blame for halitosis, and also people with sinus conditions or stuff. But you said it's really most of it is really in the mouth, and that's the reason for $1 billion industry
Based on
that
research, it's
uses
just
makeup.
15% of 15% of that condition is a result of halitosis. The rest is all oral condition.
Wow.
But those are
I, I,
treatable. The
I,
sinus is treatable.
because I've seen many patients with a quite decent mouth, no reason to think that it's coming from the mouth, and I will. They would in Mexico City. There is so much pollution and the height and even though we don't feel it, there is a lot of humidity. So many people have allergies all year round, and many people would have postnasal dripping, and I would send them to the ENT, but I feel bad because you're saying that a lot of them might have been just really, really mouth-related conditions. And I hate you go in Mexico to the cashier and it's full of breath makeup, mints and chewing gum and all kinds of, of things just to do a 5 to 10 minute makeup, and then whatever it's there, it's going to come back.
Yeah, but you see, seeing these patients during the years, the problem is that the sinus condition and the postnasal drip, and you can address that. You can treat them with antibiotics because bacteria are going to break down the postnasal drip and cause the bad breath. But you can clear that up. But a true halitosis that some of the patients are suffering from, that even from oral condition, is so hard to treat. These can clean up, so you can put them on antibiotics. They do better in 2 weeks. But the chronic halitosis patients are not, and those are very frustrating treatments.
Michael, do you have another question before we go to the second part?
No, go right ahead.
Well, we're going to see a short video and then we'll continue with Dr. Violet. Please don't go away.
OrthoGuard es una línea completa especializada para quienes usan aparatos de ortodoncia. Cuenta con 3 productos de uso diario que ayudan a prevenir las lesiones de mancha blanca en los dientes. El enjuague bucal especializado Colgate OrthoGuard, con una fórmula revolucionaria en el segmento de los enjuagues bucales, le proporciona a los consumidores una efectividad terapéutica en el tratamiento ortodóntico y en pacientes de alto riesgo de caries. Llegamos a los espacios irregulares generados por la adhesión de la resina y el bracket, previniendo la desmineralización del esmalte hasta un 58%, libre de alcohol, sabor agradable y de uso diario en personas de 6 años en adelante. El nuevo gel dental especializado Colgate OrthoGuard, con 5000 partes por millón de fluoruro de sodio, ideal para personas en tratamiento de ortodoncia y o con alto riesgo de caries. Revierte 3 veces más las lesiones de caries inicial y proporciona hasta 40% mayor reducción de caries contra una crema dental regular con fluoruro. Es seguro y se recomienda usarlo diariamente, una vez al día durante el tratamiento ortodóntico, indicado para personas de 6 años en adelante. Durante el tratamiento de ortodoncia, los cuidados de salud bucal exigen mayor atención. Los brackets y alambres ortodónticos pueden impedir una buena higiene bucal. Por eso Colgate ha creado el cepillo dental especializado Colgate OrthoGuard, con cerdas multinivel, indicado para quienes usan aparatos ortodónticos. Gracias a su forma en U, cubre toda la superficie del bracket, mejorando el efecto de limpieza en la encía, dientes, alambres y brackets. Las cerdas externas en forma de espiral eliminan la placa dental en la línea de la encía, proporcionando así una mejor sensación de limpieza en los tejidos bucales. Y a su vez, las cerdas internas auxilian en la limpieza alrededor de los brackets y alambres ortodónticos. Sus puntas de 0.01 milímetros pueden limpiar pequeños espacios, proporcionando una mejor limpieza de la superficie de los brackets y alambre. Colgate, siempre a la vanguardia del cuidado bucal, presentó Colgate Guard, la ciencia detrás de tu sonrisa.
Okay, so I guess we should go to the second part. Violet, I'm going to ask you to talk a little bit louder, if you can, because some people say they cannot hear you. So I don't know if you want to get a little closer to the mic, and let's go to the second part.
I will try to talk loud. Yeah. How do we treat oral halitosis? It's a very challenging treatment and challenging process. Mainly, the first step is to treat oral infection. periodontal disease is associated with a very strong smell, so periodontal disease have to be treated, caries or other oral infections. So that's the first step. Also eliminate the tongue coating because that's a big part of oral halitosis by tongue scraping or brushing. And also in some situation, local or systemic antibiotics we use, and major lifestyle changes like adjust diet or avoid dry mouth. And that is a big step, avoiding dry mouth. The biggest challenges in treatment of halitosis is oral biofilm. I will talk a little bit more about the oral biofilm because that's a condition that makes everything oral biofilm is making periodontal disease challenging to treat and peri-implantitis challenging to treat. Also, halitosis is very challenging to treat because of the oral biofilm formation. Also, oral mucosal surfaces are found to be reservoirs for pathogenic bacteria. So actually treating and eliminating all the bacteria, some of them are invading oral mucosal cells, surviving treatment and coming back and reinfecting the area. Also, they can shed to saliva and be transferred to other areas in the mouth. So oral biofilm makes everything of the treatment of these conditions very challenging. Right. Is it just a picture like the A and the C, like the green and the red one? There are, I don't know if you can see my little cursor or not, but probably not. It is invaded, it shows that invaded cells. So these buccal mucosal cells are invaded by bacteria. And when we do the treatment of either mechanical treatment or antibacterial treatment, these bacterial cells can survive inside the mucosal cells and reinfect the area. Also, the tongue biofilm is a very important and very challenging surface to treat. The yellowish picture, because I can't see it, I can show on it. It shows the layer of biofilm. So if it makes it very challenging to also to treat. And a picture is going to show the next slide, please. This graph will show that why is the biofilm so challenging to treat? Because most of our treatment that we test in the laboratory is against single cells. So single bacterial cells, we identify and test the effect of toothpaste, mouth rinses, antibiotics, but it is totally different when you use these products in the mouth, where the bacteria are in the biofilm, in layers of bacteria are present. So these antimicrobials suddenly have a totally different surface and a different effect, and they are not able to kill the bacteria in this layered biofilm where the bacteria are layered up, and it makes it very challenging to treat the biofilm. The next slide will show just like the level of like the single cells, the MICs is a minimal concentration, shows that against single cells, for example, a compound is very, very effective, but once these bacteria are in the biofilm, the same concentration is not going to be effective in the biofilm. So that makes it very challenging with the mouth rinses and with the toothpaste and everything that we use in the oral cavity, and same with the antibodies because we are treating organisms that are protecting each other and forming a colony that is quite inaccessible for these products. Next slide, please. So today, the best way to eliminate the biofilm in the oral cavity is still the mechanical control. After all the research and all the mouth rinses, toothpaste that we are researching, the simple mechanical treatment is the most effective one. So on the top slide, the red, the green surface shows the biofilm, and next to it is the brush surface. So a mechanical treatment of the surface eliminates the biofilm. So that's a very effective way to brush as often as possible and floss and eat balanced diet in order to maintain oral health. That's still the recommendation from an ADA. That is the most effective way to eliminate biofilm that is causing problems and diseases in our mouth. Also, the other mechanical treatment is the tongue cleaning. The tongue has been very effectively treated by or cleaned by tongue cleaners, but the tongue is very important to be treated or cleaned every day because these bacteria can invade the crevices and the bacteria can hide and create and create all these volatile sulfur compounds in the crevices of the tongue. So it is very important to clean the surfaces. Also, if there is a very large accumulation of, especially in the older population, where a tongue coating, the tongue surface is not treated, it could lead to aspiration and lead to pulmonary disease, pneumonia. So it is quite an important area on the surface to make sure that we keep clean in the oral cavity. Next slide. This is just a number of different tongue cleaners that are present on the market, and the tongue cleaning can be just done with a toothpaste as well, but these devices can clean the tongue very effectively. This slide just shows that why is it difficult again, just to emphasize why is it so difficult to clean the biofilm. So the green product in the microscopic picture shows the live bacteria, and on the left side of it is a treatment with toothpaste A, the biofilm. On the right side, it is a treatment with a toothpaste B. These are two different toothpastes, and it shows that like one toothpaste A is much more effective in treating bacteria than toothpaste B. But you see the red cells are dead, the green ones are still alive. So it's much more effective, but it's still like a lot of live cells are present. And as it indicated, toothpaste B was not so effective in treating this biofilm, tongue biofilm. The mouth rinses have the same problem. If we look at this microscopic picture, mouth rinses have a hard time getting deep into the biofilm. So some of the bacteria are killed by the biofilm, but as it's indicated in the red and the green picture, the green cells are all still alive. So even the most effective mouth rinse that is effectively kills all the bacteria in a single cell or in the laboratory condition. In the biofilm, it has a totally different effect. So still a lot of cells are going to stay alive. So the effectiveness of the mouth rinse is challenged by the biofilm. We in the lab during the years tested a number, almost all the mouth rinses on the market, and try to find one that is more effective to treat halitosis than another. This is just a couple of mouth rinses, not going through all of them, but surely PerioGuard is one of the gold standards. So PerioGuard is very effective in treating halitosis. Also, mouth rinses that don't have alcohol are more effective than the one that have alcohol. Is just because the alcohol can dry the oral cavity. So the ones that don't have alcohol in them are more effective. For example, also just the Crest and a Colgate Total, those are newer ones on the market. Their active ingredient is cetylpyridium chloride. They don't have alcohol. They are all effectively able to treat halitosis because the cetylpyridium chloride is very effective. Next slide, please. Some of the metal compounds like zinc, mercury, and copper are also very important ingredients in the treatment or these products that we can buy over the counter because they are because of their affinity to pick up sulfur-containing gases. They're not going to eliminate or cure the situation or dissolve the problem, but they're going to mask or temporarily eliminate the gases that are produced by this bacteria. A lot of the mouth rinses that contain chlorhexidine, cetylpyridium chloride, and zinc lactate are effective is because zinc has a great effect of picking up the gases and eliminating the gases in the oral cavity. Next one, please. So these, the products that are over the counter and the gums and the sprays and the mint tablets, these are masking the situation. So they're not treating, but temporarily for hours, they alleviate the bad breath, but they're not going to clean and clear up the bacteria and the underlying reasons for the bad breath. So these are just masking and temporary relief of the halitosis. Next one, please. Probiotics are also big on the market, especially in the last couple of years. They are advertised as effective treatment for halitosis. Unfortunately, very few studies are done that show that their product is really working against halitosis. One, the Streptococcus salivarius K12 has a good research or somewhat a more believable study that shows that may have a fighting effect against halitosis and halitosis associated bacteria. Unfortunately, the research the research studies are always small and not very well controlled. So I never used it in my treatments for patients, but it is very widely advertised on the market that are effective against halitosis, but the research behind them is not that effective and not that convincing yet. So probiotics and their role in the oral cavity is it might be interesting, but they have an direct interaction or competitive. I cannot go through right now to all of the different effects, but or just an indirect interaction. That means that they either inhibit the attachment of the bacteria or they compete with each other. So the good bacteria compete for the surfaces, so they prevent the bad bacteria or gram-negative bacteria to attach to the surfaces. So as we introduce more probiotic that have a beneficial effect, they will fight or compete with the bacteria that have a negative effect of the oral cavity. So there are a variety of different modalities for the probiotics to work and show beneficial effect in the oral cavity. Unfortunately, the research behind it is not that convincing yet, but hopefully we can develop some treatment option with probiotics in the future to prevent and control the bad bacteria. Next slide, please. So despite all the research and all the products, the thousands of products on the market, and all the studies, our knowledge is still very non-specific. The therapy is mainly oriented toward reducing the biofilm accumulation by mechanical means and by toothpaste, mouth rinses, and future therapies will hopefully target colonization and the growth of bacteria that are associated with halitosis, maybe through probiotics or some other means. But today, unfortunately, our treatment is still largely non-specific and mainly directed to mechanical treatment. So I don't have a magic wand to tell that this is what you have to do in order to eliminate effectively halitosis. But the companies are very aggressively working on developing new treatment plans and new treatment options for this debilitating and devastating condition. I can take some questions and maybe further
Sure.
talk
Well,
about
we'll
some
go
of
to
the
a short
different.
video. Thank you, Violet. I think it was very. I do have some questions from the audience, and I do have also some of myself. But let's go to a short video and come back. Please don't go away. We'll be right back. Okay. Uh, well, I see two missing actors here. One is xylitol, or I don't know if I pronounce it correctly. Is it really
Yeah,
help a
that's
little bit?
it is it's a chewing in the mainly in the chewing gum, and
Chewing
it
gum
does help in
or biotin, the rinse or the
yeah,
toothpaste, they're based
the
to they're
biot
target to people with dry mouth.
yeah the biotin will target the dry mouth. It will have some effect of halitosis, but it's just alleviating the dry mouth. It is not killing bacteria. Biotin doesn't have antimicrobial effect. It and xylitol will increase the saliva flow, so that alleviates the dry mouth, so that will have an effect, but not by eliminating the bacteria or an underlying condition.
Okay. And yes, Michael.
Yeah, Violet. So it seems to be a lot of different etiologies. Are there any established algorithms that are available, either published or you can help us with, how a dentist can go through different type of models, how to determine what the true etiology is? Because it seems like either you don't have a lot of choice. You just do the masking effect, you do symptomatic treatment rather than doing definitive treatment.
And in my experience, we don't have that, and most of the dentists don't even attempt to treat it because it is so hard and so frustrating. And if it's a sinus associated, or usually in my experience in doing all the research, the dentist will send you to either to have a sinus evaluation or GERD. They say that you have GERD and that's what causes it. So those are in my experience, those are the two treatments that the dentists do basically. I guess we don't treat it too well in the, don't teach it too well in the school because we don't know much about it. So addressing it meticulously, that clean your, what to clean and use. I like to use a lot, make sure that the patient treats the tongue really well, and the water pick is very effective, and I find ways, but the patient has to invest in a lot of effort in keeping the mouth clean and cleaning up all the areas that are harboring bacteria, deeper pockets, faulty restorations, and get all that out before. And surely then there are other underlying other reasons that has to be addressed. So, but in
But
my
it seems
experience,
like
mainly,
But it
I'm
seems
sorry.
like you're going first addressing what might be local etiologies, and when you've gone through all of what might be local etiologies, that's the time when you go to systemic.
Yeah, that's in my that's my approach to it. But it is hard because we don't have a good established approach how to treat. And the patients who come in, they are very, very desperate. It is a condition that I feel very sorry for people who are really have a chronic halitosis, because it's a lot of work and a lot of effort to treat it.
Violet, I don't, the other missing actor is hydrogen peroxide. There used to be a doctor that used to go all through the United States saying that the only treatment for perio you needed is to put a little bit of warm water and then just put some peroxide and put some sodium bicarbonate. And if you rinse with it, the periodontitis will go away. But we know that it's not so. But does it help to people with halitosis? Since a lot of the bacteria are anaerobic, I guess the using of these even new products that are in the market that you can rinse with.
It wasn't effective. I think that all the mouth rinses, or in all the studies that we did, the mouth rinses that are on the market with the cetyl pyridium chloride are very effective. So those are good, much better, much more effective than um, than a peroxide. Also, there are studies that with Arm and Hammer, the baking soda, or oxygenating products that produce oxygen. There are a whole bunch of products that are out there on the market, but my favorite ones are still the cetyl pyridium chloride containing mouth rinses, beside the the Colgate Total toothpaste that used to have triclosan in it, which it doesn't have anymore. So that was a very effective toothpaste to brush the tongue and the teeth, and worked really well, but it's not on the market anymore. So I'm
Which
not
which one?
saying that. The Colgate Total that used to have the
Oh,
triclosan in it, but it doesn't have triclosan in it
okay.
anymore. They
No,
eliminated the
yeah,
triclosan.
yeah. Now,
Right.
what about Parodontax, which is also is a German, originally a German
Yeah,
toothpaste with some very salty. It
it
may go
was
good with tequila, though.
very salty. It's very salty. Um, I'm not saying, but it's not my favorite toothpaste, but it's very salty, and it's good for periodontal disease. So, and bleeding, they advertise it for bleeding. I did study it at one point, compared to some other toothpaste. So,
Violet, you talked about
yeah.
probiotics. Has eating yogurt any effect at all?
I guess it's shown that eating yogurt is it could help with halitosis. It's just because it have the natural probiotics in there, and the
Right.
bacteria, and that is one of the food that is advocated to alleviate halitosis by eating yogurt daily.
Great.
Eh,
All right. So we got one solution.
Yeah, one solution.
Now,
If they are good
I
every
read you.
morning.
I'll read you some of the questions from our audience tonight. Is male or female has any difference in halitosis, being a man or being a
No,
woman?
it's as I said in the beginning, there is no good distribution. We don't really know of the widespread of the halitosis, but based on the studies so far, it's equally affected. Men and women are equally affected by the condition, so there is no discrimination.
And oral pH, does
Oral
it make a
pH
difference or?
definitely. It makes a difference, but that's like by the food and the dryness and the conditions. Yeah, sure. Like if you're more acidic, you will have a worse condition.
Are any races more prompt for halitosis than others?
Um, I I, read a study that like where Japan had a widespread measurements, like they wanted, I think they had like something like 50 something percent of the population, which was pretty high, but it was not I never found a study that compared that the races against each other. you I can't even speculate on that one because in my practice I seen everybody.
So, well, I'm going to combine two questions here. You mentioned different causes, and one was a genetic cause. So, can halitosis be cured in people who have this condition, or just makeup?
No, it's like unfortunately, that was a recent study. They of researchers were looking for families that they have more than one person affected by bad breath, and then found a couple of families in I guess in Germany, Portugal, and Scandinavia, and they looked at their everything about them and looked at their genetics and found the same genetic mutation in all of these families. And and then they went on and then did a genetic mutation in mice, and they found that if with the same genetic mutation in the mice, they accumulated the volatile sulfur compounds in their blood. So it's really truly affected. It hasn't had an effect on the volatile sulfur compounds production. So it is, but the conclusion was there is nothing these people can do with the genetic mutation. And the conclusion was also that we don't know how widespread that genetic mutation really is. So this is kind of a recent papers, so it's not much known about it yet, but there's no cure for those people who have this genetic mutation.
I
So
have
they
another
stuck with
And
question.
it.
I have
sure.
another
Yes.
question here from the audience. Now, you talked about bacteria both in the stomach and as well as in the mouth. Is there any quantification of which one is the most common etiology to halitosis? Bacteria from the stomach or bacteria from the mouth?
Um, I mean, it's like what is believed that the bacteria in the mouth has more contribution to the halitosis than from stomach. For some people, yeah, the stomach is but it's curable. Like I guess they give you some medication and then like the Helicobacter, and so those are all have a strong effect on halitosis. But they put you on antibiotics and that cures it, so it is easy cure. So I don't find those as frustrating, and the oral halitosis that we can't really, it's so hard to cure.
Thank you.
We're gonna go to it's not a video; it's a short notice on the future courses, and then we'll come back. I still have a few questions for you, Violet. And we want to invite everybody to join us, to join ID Academia in this. It's a marketing class. You can do it online, or with all the necessary measures. You could be in the room with the lecturer. It's going to be on with limited space, and it's very interesting. You can call ID Academia and find more if you call 556803 5885. And we also want to tell our audience that all our programs in the from the past and even to today's program are completely free. Please don't let anybody try to sell you a disc with all the programs. You can just access ID Academia on YouTube or on Facebook, either in Spanish or in English. And all our programs are absolutely free. I will remind you that everybody that appears in this program, we do it pro bono. There are no honorariums for Michael and me, and no honorariums for our guest speakers. We do have sponsors, and it's to ease the cost of the production. I have a couple more questions for you, Violet, if you want. You mentioned a diet. Can you recommend something as what would be a good diet for people that really have this? Of course, this can be multifactorial. As you said, some people may eat a lot of garlic or a lot of this or a lot of that, but people that were already tried different things, antibiotics and rinses, and extensive or very good oral health measures of brushing and rinsing and flossing and everything. Is there something on the diet that you recommend that will ease the problem?
There are, if you go online, there are a number of not products, but diet, like the yogurt is one of them, but then the caraway, the parsley, and a number of seasonings that they show that it is helpful and going to alleviate the bad breath. But the most common ones are the parsley and the caraway seed, and different other herbs that are on the list that alleviate the bad breath. Mainly, but I forget what exactly but these are the ones that come to my mind most of the time, and then I know that when I want to do it, I use the parsley and the caraway seed. Those are very effective.
Some
But yeah,
this is also a mixture of questions. Some people, they get the halitosis through their life, so they're not aware. Many people cannot breathe their own breath. And have you had any cases where you have to, or how do you tell a patient, listen, you have a, it's like you come and you ask him, hey guy, do I have bad breath? And they said, no, you don't. Oh, well, you do. No, there is no easy way to tell somebody that they have bad breath when it's a problem that it's chronic. What's your vision on this?
That is so when you do a study, it's easier because you measure it and then the machine shows you so that you have it. So then so that's easier. But just the plain patient, it's tough. So we are all bad. We talk about the patient's back that, oh God, it has such a bad breath, and then that people like, okay, these people all have bad breath, but it's hard to tell them that you do. And but most of the time it's like the patient who come in and they want their breath measured. It's like my girlfriend tells me that if I sit in the car, that's like they smell it. So it's usually family members are easier to say that than the dentist. But there are patients who come in and they want to have their breath measured, so because they want to make sure that they are okay. But it's really hard. That's a hard situation.
Yes.
It's even worse when the patient tells the dentist that the dentist has bad breath.
Well, with K95 now nobody has bad breath.
Now you have to wear 2 masks, so it's probably we don't.
You're safe.
Yeah.
Is pregnancy a cause for bad breath or hormones?
Yeah. Oh, yeah. That's the hormones. So the pregnancy could be, and then usually young girls, like the teenagers, teenager girls tend to have bad breath because of the hormonal changes, or the menstrual cycle has an effect on it, like in a certain in certain days on the menstrual cycle, women tend to have worse breath than because it's a hormonal changes. Yeah, that has a great effect on it.
Okay. And anger,
Stress,
you talk about
stress.
you talk about stress, but people who are anger, or maybe is the
They must
adrenaline
be
that you
stressed
that
because that's why I don't. I guess they must be. I just. Um, it's very easy to see the stress because since I'm teaching so long, so on the days when we have the 90 students and they have an exam, by 5 o'clock when the exam goes through, they smell so bad. But it's not because they have halitosis. It's just they're so stressed out. So that was always
okay.
like a big indication for me that stress has a great effect on bad breath.
It's very
And
lucky because if it had been on the COVID and everyone has 6 feet distance from each other, you would never have realized it.
well, Michael, you smell my next question. With now they're talking about training dogs to scan people to see if they have COVID or not. Do you think it's possible that
I think it is.
Joking
I think it.
aside,
What?
joking
I
aside, Jaime, they actually can train dogs to smell cancer, specific cancers,
It
and
is
that has
not a
been shown.
joke.
yeah.
No,
No,
it's
no,
It's
no.
no
not a
You
joke.
mentioned
joke.
that. No, 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 no. But they try to train them now for COVID. I
Yeah, I
read an
saw
article
that.
the other day.
Yeah, I saw that one. It is. I since I know that there's a lot of studies, especially um, the army was doing a lot of studies with the dogs to smell things. But then they started. They are these studies that like in a nursing home, the cat will sit to a person and the person next day dies because they or like in a couple of days dies. They smell something on them. So I guess those studies were very interesting to me. So the dogs and the cats can smell something that we can't identify yet. And I truly believe that maybe if the COVID, maybe they can smell, but cancer, certain cancers, the dog can smell, like lung cancer. It was shown that the dog can smell it before they actually medically detected. But we don't know what they smell yet. At least I
Jaime,
didn't read it.
Jaime, you can do it with a cat also, by the way. It's called a cat scan.
Okay. Now, well, I would like to close by asking you, unless Michael has another question. Do you foresee in the future more tools to identify other than the sulfites, or is it being such a huge industry on makeup, what I call makeup, mints. Mint has been
Yeah.
used for centuries for bad breath. I can imagine the people who started to kiss in the Middle Ages, and when they didn't when they didn't wash, rinse, or brush their teeth or mouth or tongue. But do you see something in the future going into dentistry to solve these kind of problems? I'm surprised of how many people really are affected by this in such huge numbers. I had the misconception that it was more of the stomach, of the nose, or really, broken down mouths, which is there is, you open the mouth, there is something hidden in every corner, little corner, especially with bad appliances or old prosthetics or poorly done prosthetics. But do you think do you foresee dentistry going stronger into this?
I hope so, but I just want for you mentioned ancient or like older in the older ages, but Michael would probably know better. But in in town they have a so the the
See.
wife and the husband can be separated because if one of them the marriage can be dissolved if one person has a bad breath. So in an ancient times, people could be divorced because one has a bad breath. But no, I mean, it's not a joke because it's in there. But
So the divorce
yeah,
can cure halitosis.
no, it cannot cure it. But yeah, it can cure it. It can
No,
eliminate the person from your
no,
life.
Jaime, it cannot cause
Yeah.
halitosis, but it can cause happiness.
Yeah. Well,
Okay,
we go
that's
to
good to know.
our last video, especially on chlorhexidine. So this is our last video for tonight, but don't go away. We'll be right back.
La línea Guard también ofrece soluciones para quien presenta problemas en las encías. El ya conocido enjuague bucal Colgate PerioGuard con clorhexidina al 0.12% ayuda a controlar el nivel de bacterias presentes en boca. Debido a su amplio espectro bactericida, reduce hasta un 99% las bacterias bucales, reduce en un 48% el sangrado gingival y hasta en un 54% la placa bacteriana. No contiene alcohol, tiene un sabor agradable a menta, fácil de utilizar y con altísimos estándares de calidad y validación científica que lo distinguen de otras clorhexidinas. Al enjuague Colgate PerioGuard se le unen dos nuevos productos que complementan y ayudan al tratamiento de las personas con problemas de encías. La nueva crema dental especializada, Colgate PerioGuard, con una fórmula a base de zinc que garantiza una acción antibacteriana prolongada que ayuda a prevenir la inflamación de las encías, la formación de placa y sarro dental. Ayuda a prevenir el sangrado gingival hasta en un 66.7%. Puede ser utilizada de forma diaria y prolongada, ya que su principal ingrediente activo se encuentra de forma natural en el cuerpo humano. Y por último, el nuevo cepillo dental especializado Colgate PerioGuard, de cabeza compacta, mango ergonómico antideslizante y con exclusivas cerdas cónicas Perisoft ultra suaves con puntas de filamentos microfinos, garantizan la eliminación profunda y eficiente de la placa bacteriana sin dañar las encías. Gracias a su cabeza con anatomía diamantada y componente de caucho, evita traumatismos durante el cepillado. Colgate, siempre a la vanguardia del cuidado bucal, presentó Colgate Guard, la ciencia detrás de tu sonrisa.
Okay. Well, Violet, thank you very much. It's been very, very interesting. I think I learned a lot of things that I didn't know because I don't read science. I have Michael explain it to me. So I really want to thank you for your, it's late in New York. It's 10:30. And thank you for being with us. It was very, very interesting. Michael, what do you think?
No, I really, Violet, many thanks. I think for me it was also very enlightening. You taught me a lot of new things that I had no idea about. And Jaime, you asked if this could be a new way or a new area or discipline for dentists. I think it's open to us. I think that's a definite should be something. And I'm looking forward to maybe seeing courses being taught about this whole thing in the future, because I think this is another source of generating money for a dental clinic. No question about
It is.
Violet,
Thank you so
something
much
else
for
that you want to add?
No, I just want to thank you for inviting me. This was a really nice platform, and I'm looking forward to seeing other presentations in this platform.
No, and we'll have you back because we in a few weeks we'll ask you to come back with some restorative topics, and don't go away. We're gonna have next week. We're gonna have a very, very interesting program. We're gonna have Dr. Antonio Lascano. He is a biologist and a Mexican scientist. He specializes in evolutive biology, and it's a big spokesman of science. He's from the National University, and it's a member of the Colegio Nacional. He's one of the people who advocate for science and for the budget that have been cut to science in this new government. So we're gonna talk about a lot of things, about vaccines, about genes. It's gonna be in Spanish, Michael. I'm telling you, you have to speed up your your Spanish lessons. No, thank you again very much, Violet, for being tonight with us.
Thank you so much.
Michael, as usual, it's a pleasure to have this time with you every other Tuesday. And we also want to thank our translator, Samantha. She's in Monterrey, and she's responsible for our translation into Spanish. And when we do the lecture in Spanish, to translate the subjects to English. So thank you again, and have a very good night. We'll see you in 2 weeks' time, Michael, with another interesting topic in English. Next week on October 13 at 1 o'clock p.m. Mexico City time, we're going to have Dr. Lascano. So good night and stay safe.
Good night.
Good
Thank you.
night.
And thank
Good
you,
night.
Violet.
Good night. Thank you. Thank
Good
you so
night.
much for inviting me. Thank you.
Si te lavas bien las manos lograrás prevenir